morning, Nigerians, and welcome to City Mirror TV. Here is another edition of our program, Issues That Matter. I am your host, Boluwatife Adedokun, and with me here, I have a guest. He's not new to the show. His name is Barrister Adebisi Kayode Amos. He's a legal practitioner, human rights advocate, and a lecturer. Barrister, good morning.
Good morning, the viewers at home, the listeners.
All right, thank you, Barrister. Welcome. We are glad to have you on our show. What we'll be discussing today is our healthcare system in Nigeria. Across Nigeria today, healthcare remains one of the biggest concerns for citizens. Despite reforms and policies, the system is still under pressure. Data shows that Nigeria allocates only about 6% of its national budget to health, far below the 15% benchmark agreed under the Abuja Declaration. And at the same time, the country is facing a serious manpower crisis with a doctor-to-patient ratio estimated at about 1 doctor to 9,000 patients, far from the global recommendation. Even more concerning, healthcare costs are pushing Nigerians into poverty, with reports indicating that about 1 million people fall into poverty every year due to medical expenses. Even more, while efforts like the National Health Insurance Authority are expanding coverage, only a fraction of Nigerians are currently benefiting, with about 2.7 million vulnerable citizens enrolled under government-supported schemes. So now, Barrister, the big question remains that, is Nigeria's healthcare system improving, or are we simply managing a deep-rooted crisis? What do you think is the root of the problem?
The major issue we are facing regarding the health system in Nigeria is the attitude of the leadership, the political leadership to the health matters of Nigerians. That's why we always have this sort of medical tourism. When it's come to a highly placed person being involved, the very serious challenges. They travel abroad. Look at the budgetary allocations. Even where they are allocated certain amounts, it will not be implemented. They only allocated on papers, but when it comes to backing up with cash, they dilly-dally. And that is why we have so many ailments that are not supposed to kill the people. People die because of self-medication, poverty, nonchalant attitude. And as a result of that, also we have brain drain of health personals dropping out of the country in their droves, almost on a daily basis. So, fundamental object of the government is to provide for the welfare and security of the people. And when people are not having good health, you cannot say you are constructing road, you are constructing hospital, you are not equipping it with a modern day gadgets. Then that is a very somersaulting policy.
All right, thank you. We've seen that brain drain is also a problem. Now, do you think the National Health Insurance Authority is also helping in advancing universal health coverage?
Yes, they have good policies as far as national insurance policies concerned on health matters. You can recall that we have a National Health Insurance Scheme in Osun State. Well, how many people are able to partake in this policy? Because of the level of poverty, because of the low level of enlightenment. So many people are still battling or are still consulting these the so-called chemists and buying drugs that are not prescribed. So as a result of that, they endanger their life. So the government needs to put their cap on a very rethinking manner and reform the policy, ensure that they actually fund the health system so that people have access to free and accessible health provisions.
All right, in some hospitals today, we have seen that some doctors and nurses, they show negligent attitude towards patients. Do you think this one is still the problem of the government or the nurses and the doctors?
Apart from the fact that they are overworked, they are not really motivated.
They are overworked.
And some of them are not even having enough retraining and training. But apart from certificated doctorate they still need to get practical knowledge. But there is no equipment, there is no enable environment where they can get this up-to-date knowledge about what is going on in the health world. So we have so many challenges facing us, and governments day in day out they seem not to have been showing enough seriousness as to the dangers health matters are posed to us. In fact, they ought to have declared a state of emergency in our health sector.
All right. You said they have been overworked and they are not well paid.
Yes.
Now, let's go to some private hospitals. This thing that is happening in public hospitals is still happening in private hospitals. Do you think they are not well paid too and they are overworked, or what do you think is the main problem?
Well, in the private sector, we don't have much of that challenges in the private sector because they have at least the resources. Before you can set up a clinic, you must have gone through certain conditions. You must have been certified by the regulatory bodies, and you must have enough experience and wherewithal. So that's why we see in most cases people leave the government hospital, they move to the private sector. And we have cases where people have been really attended to positively in the private sector. So the only challenges in the private sector is to regulate them, because there are some quacks that are operating that are not supposed to even get a license. So those people should be flushed out from the private sector.
All right. Oftentimes we have seen our government being taken to abroad just to take and treat themselves.
Yes, that's what they call medical tourism.
Okay, medical tourism.
Yes.
Now the hospitals we have here, they are not concerned about it, and the doctors are not working. So what do you think will now be the solution to these issues? And what do you think the citizens should do?
Well, first and foremost, citizens should agitate for their rights, because the right
they should agitate for their rights.
It's a national. There are so many international conventions on health matters, maybe treaty, even African Treaty on Women and People's Rights. It is the duty of the government to provide for an enabling environment, because there are so many. Because health is wealth. If you don't have good health, can you work? Can you come out of your house? You cannot come out of your house. You cannot do anything. So health is the primary thing. And what government God created Adam and Eve, He gave them that sound mind. When you don't have any good health, you cannot have sound mind.
Okay, you said they should agitate for their rights.
Yes.
How will they agitate for these rights?
By peaceful protest, by taking government to court. You can file a suit on that.
So you mean that they can take the government to court and still win?
It's a justiciable right. When you look at Chapter 2 of Fundamental Right on the Right Principle of State Policy,
Okay.
it is stated there that from Chapter 14 to Chapter 15 that there are certain objectives of the government, including health objective, that they must provide accessible and affordable health facility for all Nigerians. It is there. The clause they are using is as soon as practicable, and the court has said that you have to budget for the health, and you have to also fund it. So, in as much as it is the fundamental and inalienable right of the citizens, it is the duty of the government and the duty of the stakeholders, the civil society organization, to take the government up by aggressive campaign. They can even take them to international community that they are only paying lip services, that the standard provided by the global health sector, they are not implementing it, and that's why we are having. Look at this of child mortality. All this should have been reduced to the bare minimum. It's only in Africa, particularly in some of the West African countries, that we are having.
All right, thank you, Barrister. And now we come to the end of our program, Issues That Matter. And I still remain your host, Boluwatife Adedokun. Have a wonderful day.